Hi, my name is Naomi, and this is my mom. And this is a story of how I got diagnosed with type 1 diabetes, which is also an autoimmune disease, at the age of
9.
9. Yeah.
And what was going on with your leg before you were diagnosed?
It was my right leg, and I was having a lot of pain, like really bad, intense pain. First it wasn't that bad, but then it started getting worse and worse.
Yeah. So we had taken her to the doctor, and the doctor thought that she had growing pains. So, and then the pain was getting worse. Well, we thought it was in both legs, but then we found out it was just one leg. Then we went to another doctor to get a second opinion, and the doctor thought that she had a leg length discrepancy. And then we went back to her primary doctor, and then she said that, anyhow, finally we got an x-ray and an MRI, and we saw a lesion on her right tibia. And that was the cause of the pain. So we were getting really worried. This was just at the end of the summer in 2015.
That was 2015?
2015, yeah. So she was swimming a lot, and you see pictures of how she had lost a lot of weight. And she was also getting very thirsty.
Yeah.
We thought that, well, it's summer, she's swimming, it's hot, she's drinking water.
Drinking water.
And she was losing weight. Finally, we ended up in, after the MRI, we saw the lesion. The doctor thought it was cancer in the bone. So we went straight to Children's Hospital, and she was admitted to the ER, taken to the ER right away.
What?
We didn't even wait, not even 5 minutes, maybe 2 minutes we had to wait.
So we just walked in.
And of course we were frantic because we're thinking she had cancer and the bone, and it was just, oh my goodness, it was drama. And then the nurses came the first time. They checked her glucose. Thankfully, were you afraid of needles?
No.
That was a surprise, because we thought she was going to be they're not going to be able to do anything. She's going to be scared of the needles and the drawing blood and all that. But anyhow, they checked her glucose the first time, and they asked us if she was diabetic, and we said no. And they came back 10-15 minutes later and checked her glucose again, and they asked us, are you guys diabetic? And we said, my husband and I said no. And then they came back the third time to ask us, are you sure she's not diabetic? Because her glucose was 550 at that point. Of course, our jaw just dropped. And then they did the test for the antibodies to see if she had the type 1. Sure enough, it was type 1. So how did you feel when you were diagnosed with type 1?
I think I was just kind of happy to know what was wrong with me, but I was also kind of shocked for words. I was like, wait, what?
Yeah.
Kind of shocked.
And honestly, we didn't know much about type 1. I just remember when I was in school, I remember hearing about type 1, and I remember thinking, okay, that's the kind you don't want to have because you're insulin dependent. That's the only thing I remember, But most of, what you hear out there is you hear about type 2. So she was admitted, and she was there for 8 days, and of course I stayed there for 8 days in the hospital. She had to, the day after, 2 days later, they had to do a surgery to remove, she had osteomyelitis. So they had to remove all that infection and pus that she had on the tibia, and that bone right here. Right here. And she had a cast from her thigh to where?
Foot.
To your foot. And you had to learn to do what?
To learn how to walk with crutches.
Walking with crutches, yeah, up and down the stairs. Because they had to remove that pus, so they had to cut part of the bone. So there was about a hole, I don't remember exactly how big it was. So the infection,
That's this big.
yeah. So the body, because of the diabetes, wasn't able to fight the infection. So, but the interesting thing is that she never had a fever, and the doctors had thought, well, there's there was no indication that she had anything going on, because there was not a cut or a bang or a bruise or anything that happened to that leg. It started from the inside out. So there was no fever or anything, So that's why the doctors couldn't pinpoint it right away. If it wasn't for the X-ray, the MRI that was done, we finally found what it was.
Mm-hmm.
And after 8 days of being there, doing what? What did we learn to do?
We learned how to live life with type 1.
Yeah, and how did we have to manage it with?
To check my glucose, and I
Yeah.
had to give myself a weird shot.
And then we had to count.
I had to count carbs.
Counting carbs, yeah, counting carbs.
Yay.
Fun stuff.
I know, right?
So counting carbs has been very interesting.
It's very interesting.
It's very nice when we buy something that is packaged and has a label of carbs.
Yes.
But when we buy something that is not packaged,
or when
like,
we go to restaurants.
or if you go to restaurants, like if you go to a big chain restaurant, there's apps, or you could actually go on their website and find what the contents of the carbs is. But if you go, and we'll do another thing about that. If you go to a little mom and pop place, or you don't know exactly what's in the food, you're like, okay, how big is this tortilla for this burrito? Or, what kind of bread is being used. So
What kind of rice is it?
it's a lot of, we'll get more into that in another time. But
Video.
anyhow, we had to learn about counting carbs.
Yay.
So it was a crash course in counting carbs and all that. So, but we were thankful, and she was thankful that we finally found, because this went on for maybe over a month, maybe
Yeah.
if not 2 months. I
It
don't
was
know.
like a couple of months.
It was progressively just getting worse and worse and worse with the pain. So, we've learned a lot. She is 12 now,
I'm 12 now.
and you're going to be 13 in just a couple of months, a few months.
Oh yeah.
So,
Oh my god.
we've learned a lot of things that we were not planning on learning.
Nope.
That was not a subject of interest, but obviously by force we had to learn this. Survive. So anyhow, so this is going to be a story about a preteen, soon to be teenager, oh no, and how we've been living
Our lives.
with
my lives.
type 1.
Type 1.
Okay, see you guys.